Hi. So you came to the hospital because you're not feeling well. You've been having some shortness of breath, you're fatigued, and you've come into the ER to be examined. The ER physician has diagnosed you with having CHF and says you need to be admitted. So what's next? I'm Dr. Naznin Jamal. I'm a board-certified internal medicine physician, and I've been practicing hospital medicine. So congestive heart failure. The ER physician says you need to be admitted to the hospital. You'll see either a hospitalist or a cardiologist, but you're thinking, what's CHF? So CHF stands for congestive heart failure. It's a condition in which the heart fails to effectively pump blood. It can be due to or exacerbated by volume or fluid overload, a new heart attack, a declining kidney function or liver function. You've had, let's say, quite a few blood transfusions in the recent past. You've developed a new heart rhythm abnormality. There are other less common causes, such as illicit drug use, and others that can precipitate congestive heart failure, but these are the common ones. When it comes to symptoms, think of shortness of breath, also known as dyspnea. This can occur at rest. It can also occur if you're doing mild activities, such as going from your bed to the bathroom, or even going down to your mailbox just to check the mail. You're unable to do your daily chores because of the severe shortness of breath. And when it occurs at night, when you're lying down in your bed and you can't breathe, that's often called orthopnea. And what you may feel is that you're unable to sleep, you're unable to lie flat, you have to add extra pillows. You may not be able to sleep in the bed at all. You may be finding that you'll have to go to the living room and sleep in the recliner. Often when patients come to me, they tell me that they haven't slept in days. Now, edema, also known as excess fluid, can also be seen all over your body. It's most often seen in the legs, starting with the feet. And often, if it becomes very severe, it can accumulate in the abdomen and in the lungs. So what do patients say? They'll report a tightness, a heaviness in their legs. They find it difficult to put on socks. They may also notice a weight gain. Coughing is another one. It can occur with or without phlegm, and sometimes the phlegm may have a pink tinge to it. With repeated coughing, patients may also explain rib pain. Now, there are quite a few symptoms associated with CHF, but these are some of the main ones that we often see in the hospital. So when your examining doctor has determined you have congestive heart failure, you'll need to be admitted, and you'll probably require further treatment and maybe a few extra tests. You may or may not be seen by a cardiologist. Now, testing includes blood work, chest x-rays, and then an echocardiogram, which is also known as a heart ultrasound. So blood work often includes a CBC, which is a complete blood count, a BMP, which is a basic metabolic panel. On that basic metabolic panel, you're going to find electrolytes such as sodium, potassium, chloride, and the like. Your renal function will also be reviewed and is specified by the BUN and creatinine. Make sure you ask your physician if your kidneys are functioning at their baseline, which is different for each person. A BNP may also be checked. Other tests, in addition to these, may be requested by your examining physician. Remember, you're likely going to get a chest radiograph too, which is a good overview of the heart in relation to your lungs. The interpreting physician may find fluid in your lungs, and they're going to refer to that as pulmonary edema. And then finally, there's a transthoracic echocardiogram, which is often used to just want to measure and quantify the functions of your heart. They'll place a wand, they'll send sound waves into the heart, eliciting an ultrasound picture, just like other ultrasounds. And that ultrasound enables a cardiologist to measure your heart's function. Now, when it comes to treatment and monitoring of your CHF, you may see the word furosemide. That's the main drug for CHF. It gets all the press. It's also known as Lasix, and the way it acts is it removes excess fluid in the form of urine. Okay? Now, the way it does that is it uses a mechanism that allows your kidneys to remove the sodium, potassium chloride, and along with it, the excess water. Because potassium is so important, and because it's affected, your body's potassium will need to be monitored frequently, which will often happen with a daily blood test. It may not be every day, it may be every other day, but expect to get blood work done. They may also order other diuretics, which include bumetanide, metolazone, torsemide, and maybe even acetazolamide. So once effective fluid removal, what we call a diuresis, has occurred, your physician will discuss discharge with you.